Good afternoon, ladies and gentlemen. I am Miklós Keszélyeg, resident at Uzsoki Street Hospital Department of Orthopedics and Traumatology, and I would like to present my PhD topic. I am investigating the long-term results and complications of cartilage replacement in the hip, knee, and ankle joint. My vision is to give a clinically relevant overall picture about the consequences of the cartilage replacement surgeries using functional MRI and X-ray scores to evaluate the outcomes of the procedures. I have right now 3 ongoing projects. The first one is an investigation of 2 arthroscopic long-term outcomes of 2 arthroscopic procedures in small to medium-sized osteochondral lesion in the knee. The second one is investigation of the long-term results of knee and ankle osteochondral lesion, osteochondral autologous transplantation in football players. We already submitted 2 manuscripts in this topic, and the third one is the investigation of the risk factors, early sign and preventive option of the hip and knee total arthroplasty revision procedures. Regarding the first one is a systematic review and a meta-analysis, and we started this at September. And as I said before, we investigating 2 different kind of arthroscopic procedure in a given size of osteochondral defects in the knee. About the background, osteochondral lesions can occur in the general population between 30 to 60% of knee arthroscopics, and from that full thickness defects are seen in 4 to 6%. As you can see in this picture, there is an arthroscopic picture. There is a hole on the cartilage surface, and therefore it can cause pain for the patient, and therefore impair quality of life, which is quite important. Because this lesion can occur in mostly in young, physically active patients, and it's quite important when they are professional athletes. So it's really necessary to have a fully functioning joint. Another issue is there is no gold standard procedure for small to medium-sized osteochondral lesions. There are several options. The 2 of them is microfracture and mosaicplasty. Both of them have almost the same indication regarding the lesion size, the life size, and the age. And therefore, our clinical question was which arthroscopy method to choose in small to medium-sized osteochondral lesions. As a clinical implication, we would like to recommend the surgical approach, which has better clinical outcome, investigating patients with osteochondral defects, comparing mosaicplasty with microfracture, and seeing outcomes with knee function, return to sport, and rate of failure. We did our systematic search with the following search key, and we have 8 eligible full text for this topic, and the data extraction is ready for statistical processing, but we needed to put on hold this project because the second one come up, and as I mentioned before, we already submitted 2 manuscripts from them. From this topic, and we investigated the long-term outcomes of knee and ankle mosaicplasties outcomes regarding football players and with osteochondral defects. So it's quite important, as I mentioned before, in the background. This is the incidence rate can occur in 30 to 60% of the patients, but regarding football players and overall professional athletes, the cartilage injury is much higher. So it can there is studies which implicates almost 40% of asymptomatic injured patient has cartilage defects, and almost 90% of them who has symptoms in the joints have a cartilage injury. So we investigated football players operated with mosaicplasty in our institute with more than 10 years of follow-up, and the evaluation was we used the joint functional joint scores, return to sport rate, and MRI scores to see the success of the mosaicplasty. Just about some information about the scores. What we used for evaluating the knee, we used IKDC with a maximum of 87 points, and for ankle we used VAS with maximum of 100 points. And both questionnaire includes questions about pain, swelling, movement, and what's quite important, sport activity as well. And we objectified MR imaging results with MOCAT, and there are several aspects with we can grade the cartilage repair tissue with this score, and this overall maximum is 100 points. Just some bullet points about the study numbers. So between 92 and 011, we had 55 players who had available IKDC score, and 24 of them had MRI scores as well. And regarding ankle, we had 24 patients and 13 MRI scores. It can seem that these numbers quite low, but it's quite important to emphasize that the highest population what I found in the study was 56 patients, including the overall population, and not just football players. So therefore, our study's main advantage is the high follow-up time and using MRI score, and I said before, the unique population, so football players. You can see the numbers. The years is quite the years of follow-up time is quite high. Both studies has overall 80% of functional score, and regarding knee, we have 70% of MOCA score, which is quite good regarding the literatures published. Just some bullet points. We don't have enough time to talk about everything. So ankle outcomes, because of the lack of long-term information, mosaicplasty is recommended by the latest international consensus as a secondary option, and therefore this is quite important study in this manner. And as I said before, the follow-up time is above average. There was a systematic review which included 60 articles, and all of them had mean follow-up 1 to 12 years, and our follow-up time is almost 14 mean years. So this is quite important. Regarding functional scores, we had a similar to other study findings, and which is quite important with microfracture as well. And regarding sport activity, we had almost 100% of our patients could return to sport, and 67 of them to the pre-injury level. So regarding this special population, after a failed primary arthroscopic management, mosaicplasty is definitely a good option to treat osteochondral lesion of the talus. As an aspect of knee, this is the same. So regarding football players, there is no article with such a long-term follow-up time, and I would like to emphasize that more than 30% of our patients had mosaicplasty more than 20 years ago. And despite this fact, the mean functional score is similar to other studies, mid and long-term follow-up score, which is quite good outcome. And 90% of our patients could return to sport, and 65 of them to the same level before. So as a conclusion, mosaicplasty is a reasonable option to treat football players with small to medium-sized osteochondral lesion in the knee, and with good long-term outcomes. about some information about the journal, which these two topic was submitted. This is a journal of cartilage and joint preservation with an impact factor of 4.63, and hopefully it will be published in a special issue which seeks to publish papers on current evidence in management of knee and ankle cartilage injuries, and the requested topic was to our institute is the osteochondral autograft and mosaicplasty in the football athlete knee and ankle joints. So these are the two titles of of our manuscripts, and as I said before, it was submitted last Monday. These are two drafts from them. And regarding the third one, I would like to start this project in April, and I would like to investigate the risk factors, early signs and preventive options of hip, knee and total arthroplasty revision procedure using demographic data, functional scores and X-ray scores to evaluate them. Thank you for your attention.
You listed a very nice results for knee and for ankle concerning the mosaicplasty. Which one is the better one, according to you?
Sorry, which one is?
Which one is the better one? Which one is enjoying a better outcome?
So it's quite hard to
very hard to compare, I know.
There's two other. So we found better statistical outcome for knee because we had a higher number of patients, but so compared to the same outcomes and same joints regarding the literature, both of them have a quite good outcomes.
You had a very long follow-up, and during the first 10 years of the mosaicplasty story, there were some technical changes regarding the technique. And how do you feel? Does it make any influence on the results or not?
Yes, it can make influence. So regarding one of the main changes was this lesion size of the procedures of the indications, and therefore in the early stages, these mosaicplasty were operated with arthrotomy, so open procedures, and as the indication were measured in between 1 to 3 square centimeter, the procedure can move forward to be an arthroscopic one, and therefore all the complications regarding the arthrotomy can be minimalized, and therefore the outcomes can be better for them.
Thank you.
Yeah, I wonder in a study what you showed that this kind of long-term follow-up, when actually the surgery changes, many other things. What is the control? Is there anything like that as a control?
So for us, we didn't make any control. So it was just a descriptive study what we found in our procedures. So basically, it's just we didn't have any time to make a control group for that.
Well, I assume there are lots of difficulties on this, and then you have very kind of good outcomes in your clinic. But if you want others to take this protocol, then probably you have to do some comparisons with some other methods.
Mm-hmm. So yeah, our comparison was regarding to literature, and I think the so writing guideline is not just, it not depends on just one institute, so it should be an international consensus. Therefore, as I said, with ankle joint, there is a lot of lack of information, so we can provide some information for the next.
Yeah. So in this line, is this really possible to do kind of classical meta-analysis on such procedures when most of the clinics actually follow their own kind of protocol?
Yeah, it is possible. As I mentioned, so my first project is investigating two arthroscopic procedure in this lesion. So yes, it is possible. So there are other published studies to make a meta-analysis from that as the first project.